Hello, everybody. Welcome to The Better Life with Dr. Pinkston. I'm Dr. Marianne Pinkston, and here to bring you another 26 minutes or so with Dr. Warren Lesser, who is with Magna Pharmaceuticals, who has partnered with me to bring my show to everybody out here. And I love having Dr. Lesser on because he always has a very unique way of presenting a fantastic topic. And we've talked about MTHFR and homocystine and glutathione and supplements and all sorts of things. And we're going to hit it again today and talk about supplements and how do you choose a good supplement. He's got a couple of great ones that we will talk about as well. Dr. Lesser, it's always a pleasure. Thank you for being on.
Good morning. Good morning. Thank you. It's a pleasure to be here. It's a privilege to be here.
Thank you.
Thank you for having me in.
Well,
I started this morning.
Yeah.
I meet these guys from church every once a week for breakfast, and we went to Cracker Barrel this morning.
Nice.
I had blueberry. Do you like blueberries?
I do. Sure. Good for the brain.
I haven't had these in years, but I had blueberry pancakes this morning with hot syrup. I recommend it to everybody. It's just wonderful. We're going to talk about good food choices today, so I really didn't start very well.
You didn't start us off right, but no problem. Well, tell us what...
I'm smiling. I'm sorry.
You do. Well, tell us what you have in store for us today.
Okay, so today we really want to talk about some choices that we can make, some decisions that we can make to help us live healthier and longer lives. And in the past, here's my presentation outline, we've talked a little bit about homocystine and glutathione, right, and myokines from muscle training, weightlifting. Mm-hmm. And so today, though, I'd like to go into talking about what does pharma grade mean? When people say, is it pharma grade, is it not pharma grade? And how does that relate to dietary supplements? And then we'll recap a little bit of the information that we've presented previously about homocystine, glutathione, and the impact that dietary sources of L-methyl folate and the active form of B12 methylcobalamin have on lowering homocysteine. And then if you have high homocysteine, what are the ramifications for the diseases that you're likely to contract? Right. We'll talk about a case study of depression that was published that's very typical to what we hear all the time. We'll recap a little bit more about glutathione, and then we'll go into talking a little bit about two of our products. I don't usually spend too much time talking about our own products, but today we want to talk about how we decided to come out with Nufola and De Novo Plus B12, which I hope you'll find interesting, and then wrap up with maybe some lifestyle choices that we all should make and some conclusions, okay?
Gotcha.
So, first item on our agenda, what is pharma grade and what does it mean? Well, the FDA uses the acronym GMP, which stands for Good Manufacturing Processes. When they go and inspect a site, a facility, they look at all these steps that I have on this particular flow chart right here. And most people don't realize it starts with every one of these steps is really detailed. I mean, we'll have an inspector in for over a week, at least. Wow. Sometimes they'll be in much longer than that. But they start with, well, how did you choose what raw materials to bring in? How do you know that the people who made those raw materials are bona fide shops? Are they FDA approved? And then when those raw materials arrive, what do you do to ensure that they are up to specs regarding the potency, but more importantly, the impurities that are in those raw materials? And then they go through inventory control, manufacturing processes. Did you check every step of manufacturing? Did you document everything? Mm-hmm. If you make a misstep, they give you something called a 483. And that 483 is like a black mark that you have to correct. And if you don't correct it soon, they can shut you down and put you out of business. Wow. And then, of course, quality testing when the products are made, the intermediate process, and then at the end. And then when you have the final finished goods, how do you keep track of your inventory? For example, especially if you have a controlled substance, like we used to have a hydrocodone product, we don't any longer. We still have a pseudoephedrine product. So they want to know where every pseudoephedrine product is going, as you might tell, because if it goes into the wrong hands, people can make methamphetamine out of the pseudoephedrine. And so we have not only to answer to the FDA, but we have to answer to the DEA. And then when we ship the product, we have to make sure we package it properly. And to whom are we shipping the product? Is it a bona fide recipient? Is it a person that's going to use the product for some kind of wrong purposes like counterfeiting, or like I mentioned, for making another substance like methamphetamine? So all these steps are very detailed, and the documentation that goes along with this is incredible. On raw materials, for example, if the FDA goes in, like we had a company in India we were importing an antihistamine from, and they were put on FDA's 6640 list. Now, the 6640 list means that you are expressly prohibited from exporting your product into the United States. Okay, so you're talking about a mammoth job that the FDA has to do when you're thinking about all the places in the United States that make drugs and dietary supplements, but all the people who actually export raw materials.
Right.
And in the raw materials, I mean, there are routine tests. For example, arsenic. Well, if you take enough arsenic, you're going to die. But the problem is that many of these substances, these impurities, for example, heavy metals like lead or mercury, that are found in the water supply of other countries. So we don't think about maybe it's India or China where they don't have the water standards that we have, and yet they're making raw materials that they're exporting into the United States that dietary supplement makers are using to make their products, and they're contaminated. So that's why it's really important to take to make sure that you use a pharma grade dietary supplement when you buy. And you can find that out by researching the company to see if they have an FDA inspection, see if they have any 483s, see if they have any problems out there. Yeast is, okay, microbes are good. Probiotics are good for our gut when there's the right amount,
right,
colony forming units. But when there's too many, then of course you can get into a lot of GI issues and maybe some other health issues. Yeast is good for us in the right quantity. Too much can cause migraine headaches, can cause GI issues. Of course, mold is allergies and upper respiratory issues.
Right.
Salmonella, E. coli, and Staphylococcus are all things that we don't want. So these are the kinds of substances that we look for in the raw materials when we receive those to make our products. Now, talking about non-regulated product risks, we had an FDA inspection earlier this year. I was talking to the inspector. He said, there are 700 million products that we have to inspect. I said, 700 million?
700 million? Sure? Wow.
Yeah. I said to him facetiously, he said, well, it's impossible. We can't inspect everything that's on the market.
Yeah.
I said, I think there's, 330 million people in the United States. So if every person, mother, child, everyone in the United States was assigned to 2 products to inspect and monitor, then we could probably be all right.
Right.
But, I mean, you can't. And then last week or 2 weeks ago, we were watching the Dark Waters. It's available on Amazon Prime. Mm-hmm. And it was about DuPont back in the 70s,
right,
when they were making Teflon, and they had a carbonate product called PFOA that they dumped it into a landfill, and it got into the water. And it's a great story, really. Yeah. They talk about deer and cows where the blood was coming out of their noses and their mouths, and patches of hair were missing. One farmer lost 153 cattle.
Wow.
And the thing that was really bad about it is that the attorney was really a pro-business attorney, but because sometimes our decisions, let's say this, great company, DuPont's a great company, but sometimes, I don't care what company you are, our decision-making can become clouded when we have a tremendous catastrophic financial implication of making a business decision. In this case, the Teflon product for DuPont, they were making over $1 billion a year. I mean, that's a big time. So they tried to cover it up. And because they tried to cover it up, this became a landmark case. Yeah. So what we're talking about here, this is just an example, maybe a rather dramatic example, but it's a good movie to watch, by the way, is that, most executives, most business people, most pharma people, all pharma people I know, really almost all, are really upstanding, good citizens, and they're responsible. We have a tagline on our company called accountability, because we feel like we're accountable to the American public. We're accountable to our shareholders, our stockholders, our stakeholders, to our God, our government, everything. It goes all the way up and down the line. But and so we try to do the things right all the time. Of course, we're human, so I'm sure we make some mistakes. But the issue is that just because a product's on the market, just because something's on the internet and they're selling it, doesn't necessarily mean that the product is not adulterated.
Absolutely.
I don't know if you've ever dealt with, Dr. Pinkston, with a dietary supplement that was maybe not up to standard.
Of course.
In quality.
Of course, I deal with it all the time with patients in the office who bring things to me. What do you think about this? And so they ask me on a regular basis. It's a very difficult job to keep up with.
Right. And you have to watch out for like outlandish or all-inclusive terms. This will cure, this will take care of everything, this is the panacea, this is the miracle drug. There's no such thing.
Absolutely.
What we're talking about today are a few products that can really help.
Right.
But they are not the panacea for curing disease. They can help along with other decisions. So that's a little bit about pharma grade and some of the risks and some of the due diligence that we should take when we buy dietary supplements or drugs. Now, let's go to the clinical side of what we're talking about today, which is the thing that we brought up before is homocysteine.
Yes.
Too much homocysteine in our blood comes from a few things, really. A deficiency of the right kinds of B vitamins, B6, B12, and actually folate is actually vitamin B9. Taking in too much red meat and dairy. We're an aging population, so as we get older, we're going to naturally have more homocysteine in our bodies. We have bad habits. We become sedentary. And many people, 32 to 64% of the population, depending upon ethnicity, has something called an MTHFR deficiency. MTHFR stands for methylene tetrahydrofolate reductase. That is an enzyme that helps break down folic acid to the form that we use. And folic acid and folate are essential vitamins. Our bodies cannot make them. We need them for DNA function of our cells, for example. The very basic building blocks of life.
Right.
So a high homocysteine level, and I think we've mentioned this before, but it's definitely worth repeating, is the main culprit. Again, not the only cause for brain and circulatory diseases, strokes, coronary artery disease, arteriosclerosis, and can reduce diabetic patients already have depleted nitric oxide levels. What does nitric oxide do? It causes your blood vessels to dilate. They become larger so your blood can flow. That's why you see so many problems with diabetics with lower leg and foot issues, that they get necrotic tissue, even amputations, because they don't have the right circulation. Because one of those factors is nitric oxide. So if you have too much homocysteine, then you have less hot nitric oxide. And if you're a diabetic patient, it makes everything worse, okay? Right. The other thing is that if you have decreased nitric oxide, that results in lower glutathione. And we'll talk more about glutathione in just a minute, but glutathione is very important as a scavenger. It cleans up the reactive oxidative stress substances that come into our bodies. Right. The other aspect of homocysteine that's really important is that it is associated with more stress and anxiety, depression, cognitive impairment, clear thinking, memory, even leading to dementia. It's also associated with diseases such as Alzheimer's, ALS, dreadful, Lou Gehrig's disease, ALS, Parkinson's, and autism. Now, the homocysteine test is not expensive. We talked about this last time, and I found out that it actually costs around $70 in some of my research. But so it's worth it. I mean, what is your homocysteine level?
Yeah.
I need to get mine tested. I don't even know what it is.
And most doctors don't test it. It's amazing to me how many doctors do not. I do, and but many don't.
You do, yeah. Mm-hmm. It's important. Do you find? You probably find that homocysteine runs higher in many patients than maybe you thought it did.
Absolutely, and the reference ranges that are on the labs are actually incorrect. Those are, population averages of a sick population. They're not really reference ranges. So when they give a reference range, the level is too high. They allow for levels that are too high. So we have to correct that on the reference ranges of the lab.
Right. So, it's worth it. Homocysteine is so important, and it's a good thing to have tested. I love the last statement on this slide. By the way, all these statements come from peer-reviewed journals, Drug Design, Development, Therapy, Current Clinical Pharmacology, Perspectives in Psychiatric Care, European Journal of Medical Genetics, Current Medical Research and Opinion, all good journals.
Absolutely.
So the reason I bring all of these sources up is because I don't want anybody to just take my word for it.
Right.
What I try to do is bolster anything we're saying, any claims with proof sources. But this bottom statement right here, the proportion of B12 and folate to homocysteine is inversely associated. Right. That means if you don't have enough B6 and B12, or if you take more of it, it's likely to lower your homocysteine level, and the converse is also true.
Right.
This statement came out of the National Library of Medicine. It was actually published in the Nutrition Journal in 2015, and the title of it was The Role of Homocysteine in the Development of cardiovascular disease. I'll just highlight, because I know we're moving pretty fast here, that there's a correlation between hyperhomocystinemia, that means too much homocysteine in the blood, and cardiovascular disease, including heart attacks, strokes. Endothelial cell damage is the damage to our blood vessels, reduction in the flexibility or the expansion, the ability of the blood vessels to go back and forth, and it alters hemostasis, which is clotting, either not enough clotting or too much clotting, especially as we get older. We don't want too much clotting in our blood vessels, for sure. So this may lead, it says, what's interesting is that if you have any of these other risk factors, like you have high blood pressure, if you're a smoker, if you're getting older, if you have high fats in your blood, cholesterol issues, or if you have systemic inflammation and you have homocysteine, now you're really exacerbating your risks, and the condition of your health is even worse. So it makes it worthwhile to check homocysteine. They say, on the other hand, right, physical activity, moderate alcohol consumption, good folate and B12 are associated with lower homocysteine levels. This comes right out of National Institutes of Health. So
easy.
Very, very strong. Go ahead. I'm sorry.
Okay. No, easy. That's a good level of information for folks to make it easy. It's not complicated. Lower your homocysteine. Very easy advice.
It really is. And next time if we do this again, I'm trying to wean off some of my conversation about homocysteine, but I'm so
it's so important.
Convinced on the fact that it's a real factor in health among Americans.
And we are coming up on about a minute now before we have to hit the break. Can you believe it? The time goes so fast. But I know, and we have to do a two-part. But since we were going to do that, I want people to understand really quickly. It'll be a nice little commercial in the center here with our break for patients to learn where they can find information on you, Dr. Lesser. And so I give it out all the time. magnaweb.com. I want for folks to know that you can find more information, but you can also find Dr. Lesser's previous talks with me on drpbetterlife.com and go through and find all of our previous podcasts. We've done quite a few now, and get more information. So drpbetterlife.com. Dr. Lesser, we're going to take a really short break and come back on the other side and try to wrap this up if we can. So remember, magnaweb.com. We will see you guys in just a minute.
Depression, anxiety, low energy, weakness, these are just some symptoms of low B12 levels. And the absorbable B12 folate supplement that's helping people declare victory over depression symptoms is De Novo Plus B12 by Magna Pharmaceuticals. Patients with symptoms of depression often exhibit low levels of folate and vitamin B12. The human body needs sufficient folate intake to produce the essential neurotransmitters serotonin, dopamine, and norepinephrine. These neurotransmitters alleviate feelings of sadness, anxiety, and gloom. What makes De Novo Plus B12 so successful? De Novo Plus B12 contains readily absorbable folate and B12. That means it's more successful at correcting the root cause of your deficiency, not just the symptoms. Whether you are suffering with low energy, depression, fatigue, or anxiety, you owe it to yourself to learn more at magnaweb.com. That's magnaweb.com. Please let us know at checkout that you heard about De Novo Plus B12 on The Better Life with Dr. Pinkston.
Welcome back, everybody. This is The Better Life with Dr. Pinkston, and I'm with Warren Lesser today, Dr. Warren Lesser today of Magna Pharmaceuticals, and we are talking about homocysteine and a couple of products that he has. But I know you have an interesting case study we were hoping to get to, so tell us about that.
Right. So we were talking about homocysteine and the implications for cardiovascular disease, including strokes and coronary artery disease, et cetera. But we also mentioned that homocysteine has implications for mental and cognitive function, and especially depression. So this is a case that was published in Integrative Medicine in 2020 by a couple of doctors. They're nutrition doctors. Very interesting. And the reason I cite this case is because it's very typical to what we hear on an ongoing basis for patients who take De Novo Plus B12. We hear from patients themselves and doctors and family members all the time about how much better the patients are doing. Absolutely. So this is a typical case. And so this is a case of a 49-year-old American Asian background female who had long-standing depression. I can't even imagine, over 20 years. Oh. And it was treatment resistant. I mean, they tried everything. And it was characterized by, she reported she had a lack of interest, a lack of motivation. She actually was sleep deprived since 2010, so that's 10 years. And that sleep deprivation led to afternoon naps. She would wake up often with a panic attack, anxiety attack, and she had a history of tension kind of headaches. She had feelings of loneliness, despair, isolation. And what they pointed out here is that typically when they see patients with depressed mood, that they are characterized by, and maybe some of your patients experience these too. Now, we're not talking about a day or two or three. Right. We're talking about persistent feelings of sadness, persistent, like a lack of interest.
Right.
Somebody who is interested in a sport or an activity, and all of a sudden they lose interest is a symptom of depression.
Yes.
Fatigue, ongoing anxiety, feelings of despair, being always discouraged, having a feeling of hopelessness, or maybe the opposite, having no feelings at all. You withdraw, and that's a human defense mechanism where we just protect ourselves and we kind of go into a cocoon. Being very tearful, not being able to sleep or having too much sleep, or a 5% weight gain or weight loss within a period of 30 days, having difficulty in concentrating or making decisions, very low energy, or feelings of guilt or worthlessness, even leading up to thoughts of suicide. That's kind of the syndrome where if your patients or your family members, people you know, have these symptoms and they are persistent, maybe you need to look into getting some kind of treatment for a depression. Now, in this patient's case, she was pretty healthy. She didn't have a very good diet. She had high fat, high protein, but she wasn't drinking any alcohol. She took no caffeine, and she wasn't a tobacco user. And all the physical exams and the screenings, the heart and lung screenings, came back normal. So we're looking at a pretty typical patient where the only problem is, I'm so depressed. I've been depressed for 20 years.
Right.
And when you look at the history of treatments, I mean, she was on antidepressants such as Zoloft, Wellbutrin, Effexor, and others. They didn't have a complete medical record. And what they found, though, is that over time, the dosages of those products were increased, or maybe another product was added to augment some. We see these ads on TV
all the time.
And they say, if your antidepressant is not working properly, take this drug. The thing is, I'm a drug guy. I know that every drug has side effects. Every drug does, because it's an intervention. It alters basic function of the body. It doesn't improve the functions that we have. It alters or interferes with something, so you're going to get a side effect, right? Sure. And the more drug you take, the more dosage. Most of the time, side effects are dose related.
Right.
So the more drug you take, the more side effects you're going to have. So it's an issue. And so antidepressants help a lot of people. I'm not trying to knock on peers in business, but what I'm trying to say is that they are not without problems. And you, as a physician, I'm sure know that as well.
Absolutely.
So what they did was they told this patient, stay on your antidepressant right now. And they looked at weaning her off over a period of time. We'll get to that in just a minute. Start either exercise twice a week for 60 minutes or 3 times a week for 20 minutes. They did that as an add-on therapy. And they added an omega-3 supplement, 2 grams a day, a good omega-3.
Yeah.
Magna has a good omega-3 that's triple distilled, so we don't have the mercury and other garbage that's in there, and it's very potent. So, and then they added L-methylfolate, and they titrated up to 15 milligrams a day. Now, this patient first presented on October 1st of 2018. By February 4th, so that's 4 months later, right? October, November, December, January. She came in for a follow-up exam, and she had a well woman exam. She didn't have depression. She didn't have feelings of despair. She had energy. She had improved sleep. She didn't have the anxiety. She was stabilized. What's interesting epilogue on this case is that months later, they determined the cause for her depression. Okay, now the treatments worked regardless.
Right.
But the cause was she had an MTHFR gene test. And she had a deficiency.
Yes.
Now, I'm told, Dr. Pinkston, and I don't know this, but an MTHFR and gene test is very expensive. And
it's actually not. You can get it for $100. If you go to empowerdxlab.com, you can get a cheek swab for about $109.
Wow. Mm-hmm. Oh, that's great. That's great information. So, I mean, right now, I know that if I have somebody in my family who has depression or these symptoms we talked about, I mean, what's your homocysteine level?
Right.
And if you have an Asian background, they're the ones that are up to like the 64% of the population have this deficiency. Yes, then you should really be testing for this, because that gives you an ironclad solution, you need more folate.
Absolutely.
So,
EmpowerDXLab.com. It's wonderful. We got about a minute and a half, Dr. Lesser.
Okay, so we'll have to go on, but I mean, we've talked about homocystine and glutathione, and I'm going to have to come back to this later on if we continue. But I will say that when you jump down to some decisions that we can make, I'm going to skip down to my last slide here.
Yes.
We didn't get a chance to really talk about myokines today, which we will going forward.
We will.
Yeah, but for about $1 a day, so these are, you have a minute and a half, so I'm getting low. So these are our two products, Nufola and DeNovo Plus B12. They both cost about $1 a day.
Yeah.
You take 2 Nufola, or you take 1 DeNovo Plus B12. Here's what's in them. Nufola has methylfolate, B6, the active form of B12, which is methylcobalamin. You don't want to take cyanocobalamin. You don't want to take anything besides methylcobalamin. You take it after breakfast or lunch, and same as DeNovo Plus B12.
Yes.
So for $1 a day,
Amazing.
if you can improve your cardiovascular health, improve your energy, improve your mood, your positive mood, and hopefully have a longer life, improve strength and stamina, and improve your mental thinking, your mental health, then can anybody find $1 a day? We're not talking. If you see an ad on TV and they say, drug the product name, if you have trouble affording product name,
right?
Then
Call us.
can help you. It's expensive.
Exactly.
Our mission is to bring safe and effective products for low cost.
And you have done that beautifully. And I quote you all the time, magnaweb.com. As Dr. Warren Lesser, I'm going to send you guys to magnaweb.com to take a look at these products. You can also go to drpbetterlife.com, find out more information. Everybody, I hope you have a wonderful week. Dr. Lesser, as always, thank you. We will continue this conversation. Everybody have a great week.